In this video, we're going to look at some myofascial self-help exercises to help with headaches and migraines. Most adults suffer from headaches and migraines at some point in their lives. With headaches, the predominant symptom is pain that is felt in the head. With migraines, there can be head pain plus associated other symptoms. So, for example, seeing flashing lights, sensitivity to light, nausea. And for some people, they suffer mainly from silent migraines where they don't actually have any head pain, but they can have the other symptoms. So what's going on? Generally, for most people, headaches and migraines come from restrictions and tension in their neck, shoulders, and upper back. And the restrictions can be in the fascia, which is the main connective tissue in the body. Because it wraps around and through all the other structures in the body, including your nerves, your muscles, and your bones, if you develop fascial restrictions in your neck, shoulders, and upper back, these can refer pain and other symptoms into your head. So in order to help yourself, you can do exercises to release some of this tension, and this can help return to your body to more normal, pain-free balance. So we're going to do some exercises to help. Make your shoulders nice and heavy and relaxed. And just bring your head over to one side. So you're bringing your ear towards your shoulder. As you do this, make sure that you keep your shoulders nice and relaxed. Sometimes it's quite a good idea to start this exercise by looking in a mirror so you can see if you're lifting your shoulders. To only go as far as is comfortable. As soon as you start to feel a restriction in the side of your neck, so maybe here, just wait and wait for a sense of the tissue starting to release and let go. Fascia is very slow releasing tissue. It takes 1.5 to 2 minutes for the tissues to start to let go. So the longer you're in this stretch, the more the fascia will release. And as that releases, so do the structures contained within it, in particular the muscles. And if it feels comfortable, you can bring your arm up and just rest it on top of your head to create a slightly deeper stretch. So when you're doing this, you're not pulling, you're not forcing, you're just allowing the weight of your arm and your hand to create a slightly deeper stretch. And then you can slowly come out of that. Just give your shoulders, your neck a little bit of a movement, just to allow things to assimilate into your body. In this stretch, we're going to drop the head forwards onto your chest and then turn your head so that your nose is pointing towards your armpit. So this stretch is good for the back of your neck, where there are muscles that attach into your shoulder. And sometimes when these get tight, they give you the sensation that your shoulders are always somewhere up around your ears. So this can help to lengthen the back of your neck into your shoulder. And so just noticing how this feels. And if it feels comfortable for you, you can bring your hand up and just rest it on your head. So you're not pulling, you're not forcing, you're just creating a slightly deeper stretch through the weight of your hand and arm. And remembering to be in the stretch for at least a couple of minutes to allow time for the fascia to release and let go. Coming out of the stretch, hold your shoulders, just turning your head. This exercise, we're going to use 2 myofascial balls. So a myofascial ball is inflatable, which means it has some give in it, and you can inflate it to whatever level is comfortable for you. Because we're going to use 2 together, I'm going to put them in a bag. This just means that they stay together when I put pressure on them and they don't ping off in opposite directions. So I'm going to lie on my back. And I'm going to place the balls under my neck. So the balls are positioned so they are either side of the spine in my neck and just below the base of my skull. So this area can get very tense. There are lots and lots of muscles and fascial tissue that attach into the base of your skull. They travel all the way up your back and they can attach in around this area, and sometimes they can become very tight, and this can be the cause of headaches for many people. So working here by just relaxing onto the balls, just allowing your body time to let go. When you do ball exercises, you need to be here for at least a couple of minutes, just enough time to allow the fascia to start to let go. And as the tissues in your neck start to soften, you'll get a sense of your head starting to tip back slightly. For some people, this might feel a little bit uncomfortable, in which case you can put a little pillow under the top of your head before you start, just to support it. And if you can let your head just drop back, you'll get a real sense of things starting to soften and to stretch. And this can really help to take tension out of your neck and therefore tension out of your head. So this exercise, I'm going to be working using 2 balls on my upper back. So lots of people, migraine and headache pain can actually come from tension in their back as much as in their neck and shoulders. So to work here, I'm going to have the 2 balls. I'm going to place them under my upper back so that they're positioned either side of the spine between my shoulder blades. And I've got a big pillow here just to help support my head while I do this. So making yourself comfortable and just bringing the pillow here to support your head. So at first, this can feel like quite a stretch, particularly if your back is tight. But just allow time for your tissues to start to release and let go. And as you stay here with the balls on your back, you'll get a sense of things softening. Your back will start to drop and relax. And it will create a nice stretch across the front of your chest. So this is helping to open out the top of your back. And this will help to release some of the tension that can be contributing to headaches and migraines. So remembering, as with all myofascial exercises, to be here for at least a couple of minutes, to allow time for the tissues to release and let go. And just notice any sensations that you might feel while you're here. Sometimes things will come and go, pains or other sensations, and that's fine. Just be with it. And just remember, this is all just fascia letting go. You can visit our website to find out more information about self-help myofascial release, or if you want to get one of our myofascial release kits.